everyone. With great respect and administration, I take this opportunity to welcome Dr. Vasavaraj sir for this. I also extend a warm welcome to our respected co-chairperson, Dr. Rajesh sir and Dr. Aditya sir. A special welcome as well to our co-chairperson, Dr. Radhika sir. It gives immense pleasure to introduce our chief speaker, Dr. Guru Basavaraj sir. He is highly represented Ayurvedic physician, academician, and researcher with over 4 decades of clinical experience and 3 decades of teaching experience. He holds an MD in Rasa Shastra, diploma in yoga and naturopathy, and has also undergone specialized training in emergency medicine. Dr. Gurubaswaraj sir has served as senior professor in Department of Postgraduation Studies in Rasa Shastra at JSS Ayurvedic Medical College, Mysore, and has also worked as Chief Medical Officer at JSS Ayurvedic Medical College and Hospital. In addition, he has been a guest faculty at the Government Naturopathy College, Mysore. He is deeply interested in importing traditional Ayurvedic knowledge to meet present day medical needs, shaping students into compassionate doctors dedicated to service societies. For his dedicated service, he has been honored with several awards, including Prajaratna, Kannada Gaurava Award, Vaidya Best Teacher Award, etc. Dr. Gurubasraj sir has been actively spread awareness of Ayurveda through articles, radio and TV programs and has been conducting free medical camps over 30 years. Now I welcome Dr. Gurubasraj sir to share his thoughts. Welcome you, sir.
Good afternoon to everybody. Chairperson Dr. VandeWellness sir, Co-Chairperson Dr. Rajesh sir, Dr. Annavedu, Dr. Kumar Swami, Dr. Rita, and Dr. Mukesh Srimati, and us, and the Organizing Secretary. First of all, ಕ್ಷಣ ನಿಮಗೆ ತುಂಬಾ ಗೌರವ ಸಲ್ಲಿಸತಕ್ಕಂಥ ದಿನ ಇದು. ಯಾಕೆಂದ್ರೆ Entromix, a novel mRNA-based cancer vaccine, has been groundbreaking promise in the treating the cancer. ಇದು ನನ್ನೇ ಗೊತ್ತಾಗಿದೆ, ಅದಕ್ಕೆ ಕಾಕತಾಳೀಯವಾಗಿ ಇವತ್ತು ಮಾಡ್ತಿದ್ದೇವೆ. ಹೀಗಾಗಿ ಇವತ್ತು ನಾವೆಲ್ಲ ನಮ್ಮ ಗೌರವ. The developed by Russian scientists, this vaccine has demonstrated 100% efficacy and safety in early clinical trials for colorectal cancer. Here is what it makes. And COVID-19 vaccine ಕೂಡ ಅವರ ಕಮೆಂಟ್ ಮಾಡಬೇಕು ಇದು. ಆಮೇಲೆ ಇವತ್ತು what the reason that I should speak on the need of yoga for managing such a dreadful disorder when they have a super specialty concept. Already we have DM in medical oncology, we have DM in surgical oncology, and also DM in radiation oncology. And also we have a pediatric oncologist like Dr. Appaji, who was my friend who considered to be one of the divine person in the field of management of leukemia that's there in the childhood, and particularly lymphoblastic leukemia. So this is really uh, quite interesting. Why is such a uh, complex, even diagnosis, treatment, and designing the plan itself becomes a stress to both the medical fraternity and also the people who receive the treatment. This is because I will not go to the history. Psychoneuro and immunology. Psychoneuro and endocrine immunology has established the relationship between the stress is most important. That is mind and this again psychoneurology and endocrine aspects are the established. Recently, I read 30 years back about the Vanderberg's works on chemistry of emotions. I was just uh, discussing with Rajesh the latest book on the molecules of emotions. Molecules of emotions. Because they are totally metastatic and surgical entry radiation. They speak about the metal approach based on the wonderful biochemistry, wonderful human chemistry, and also good physics, and also the latest, the what you call atom energy, and latest concept of the molecular biology. So such a complex, such a wonderful established concept of when existing, what's the meaning? That is my. So quite interestingly, when I was going through, I got this. The work is done by Adina Dire in 1970. In 1975, Robert Ada Nicholas, the University of Rutgers Advanced PNI, and he again established subsequently the concept of how the leukins responsible for the causing the leukemia, how the emotions, particularly molecular biology, how the molecular biology concept has been. Today we are able to understand the very early about the concept of cells of islet cells of Lagrange to know the diabetes. Human cell biology, they put islet cell biology. Still their area also they require some integrity. My talk is to be on the integrity approach. So now, only to establish your mind and the young students, that mind and body relation is not only a spiritual concept, or not only a philosophical concept, not only a physiological concept, it is of the latest concept of again establishing the relations between endocrine, immune chemistry, and also human biology, and also molecular biology, and particularly psychoneurons. Psychoneurons hormones are going to work upon or with the help of yoga. That's it. So, friend, just I want to pick another 3-4 minutes and what is the present medical scenario. The first slide, in every abundance there is a lack. The father of modern medicine, Hippocrates, has said long back. Okay. Now, what preamble I spoke about the why yoga requires establishes never abundance there is a lack. And next, education is not a matter of always seeing the new things. Education means seeing the same things in new light. So this is because yoga is basically a Manodarshana Shastra, meant for philosophy. It's not. It's a Sankhya Yoga philosophy. It is not related to physiology. It's not related to many of the materialistic aspects. So the purpose of them was Manodarshana, seeing mind. So such a concept. So now we are going to see the new light of that concept. That is, we are going to know about the therapeutic benefits of yoga. Next slide. We are living the era of super speciality. That is most important. And again, why an integrative approach? So now see, rheumatology is well established now. Pediatric rheumatology, pediatric immunology is advanced. Even then, why the integrative approach is required in the management of junior rheumatoid arthritis, etc. with the help of Ayurveda. Okay? So this is and also similarly it applies to the concept of yoga also. So now, next slide please. So this is the era of rehabilitation. You have the rehabilitation. So anybody reaching the age of 40 plus is bound to have some that disorder. So you have to rehabilitate. ಪುನರ್ವಸತಿ ಮಾಡ್ತಕ್ಕಂಥ ಸುನಾಮಿ ಬಂದ್ಮೇಲೆ ಪುನರ್ವಸತಿ you have to rehabilitate it. The rehabilitation is the need of yoga. And there's a well saying is there, before 30, men will seek disease, after 40, disease will speak. ಮೂವತ್ತಕ್ಕೆ ಮುಂಚೆ ನಿಮಗೆ ಏನಾದ್ರು ಡಿಸೀಸ್ ಬರ್ಬೇಕು ಆ ಪ್ರಾರಂಭದಲ್ಲಿ ಹೇಳಿದ್ರು ಪ್ರೀ ಲಂಚ್ ಅಂಡ್ ಪೋಸ್ಟ್ ಲಂಚ್ ಸೆಷನ್ಸ್ ಆರ್ ವೆರಿ ಡಿಫಿಕಲ್ಟ್. ಪೋಸ್ಟ್ ಲಂಚ್ ಅಂದ್ರೆ ಫೋರ್ಟ್ ಪ್ಯಾಂಟಲ್ ಬ್ಲಡ್ ಶುಗರ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ, ಪ್ರೀ ಲಂಚ್ ಅಂದ್ರೆ ಅಶ್ವಾಗ್ತಿರುತ್ತೆ. So it's difficult for me also. So that's why something, though it appears to be liquidating the subject, I want to carry with some laboratory solution. Next, before 30, men will seek disease, after 40, disease will speak. So now again, why I accepted this talk? Because though I am not a, this is the first conference in my life I am speaking, the way I have not treated yet this disease. Okay. These are, that's why I am exploring the different works done across the globe. Dean Arnold is a Californian cardiologist. California, he has come out with the reversal of the heart disease by lifetime modification. So here, why I can, again, there also I write, open your heart through emotions, not by life. Triglycerides, which is supposed to be intrinsic factor, that has to be increased by the emotions. It's a culprit for heart attack. So Dean Arnold, sorry, here we have that program also. Dean Arnold is reversal of disease. He is going to identify the risk factors with the help of lifestyle modification. So again, cancer or oncological disorders is related to the lifestyle disorder. We listen to all the three previous speakers. They are systematically related prevalence, cause, etiology, and also again this. So in Ayurveda, they say Nidana Parivarsana Chickis. Maybe 5 students are you should know. And Karaka Karmana Gene, that what speaks about the theory of these use and disuse approach. That most significant in the case of chronic disease whatsoever. So DNRs has established their intrinsic factors or emotional factors are going to play. So he is in the slogan bypassing the bypasser is slogan is there. So when such a surgically interventional disease can be reversed with a collateral opening, why I should not take this? Again, stress management of psychosomatic disorders through is again a therapeutic protocol in Ayurveda. And here, Dr. K. Nudupa, the former vice chancellor of Banaras University, first established the neurotransmission phenomena benefits through yoga. That's one. So next please. So again, we should have a glance why you should have integrated approach. So look at disease prevalence. So here, barring infectious disease and surgical disorders, allergic, anything beneath the sun cannot. Beneath the one girl is in Brazil, she is suffering with a condition known as acromegalia pruritus. When little water is brought up, she will have pruritus. So among all the disorders, you look at a glance. Whatever will be, except surgical disorder and cardiac, and then infectious disorder, and some of the emergency 3. So that makes about not even 1% of the whole disaster. So all other systems, they require integrative approach. Integrative approach means not only all the medical systems. We should think in Ayurveda to set Dravya and Upasasana chapters, and then medicine and attendant and wife and then physician and a nurse. So the nursing is going to play a very integral role. ಯಾವ್ದಾರ ಒಂದು ಡಿಸೀಸ್ಗೆ 4 ಬೇಕಾಗಬೇಕಂದ್ರೆ ಅದು ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ಮಾತ್ರ. Take all palliative care and other things. Next slide please. So there are different healing systems across the globe. And you know, remember this gentleman who they received the Nobel Award for traditional Chinese medicine, which are often called traditional changes because they are adapted. If you go to the China, you will have the most herbal medicines are kept in all the major hospitals. So these are the different medical system, Ayurveda, Jainism, etc. And no medicine system is sufficient enough to cure all the disorders or manage all the disorders. All systems are not enough. You see, I said yoga is basically related to the Manodarshana, philosophy of mind. Why we have different medical systems? You have Ayurveda, Chinese, allopathy, Nani, etc. So yoga is this. So therefore, I thought I should add some what I call relevant comments about why the yoga has been selected. Next slide, please. So already all my earlier three speakers wonderfully presented global and national scenario of cancer. Oncology is a super specialty that I mentioned. Medical oncology, surgical oncology, radiation oncology, pediatric oncology, etc. So the prevalence of cancer and all aspects of it dealt very well by. So I need not go. They have made my job much easier and also reduce the responsibility. Next slide, please. Next slide, please. So need for integration. Why ethic break with integration? And just because I made a disease establishment, not because that one. It's a holistic approach is required, as I said earlier, for the management of cancer. All the four essential: physician, medicine, attendant, and nursing. So all the holistic approach is essential. Not all the medical system, all four essential routines. So my why nursing? Because Rogeshu Maitri Parana, etc. etc. So today, most lectures are there, I don't know how to understand. Today, the allegation made about the medical profession, you are a wedding nurse, you know, not about the knowledge, not about the skill, not about the skill, definitely not about the gadgets. The attitude of the medical professional towards the patient is the allegation. Okay? You have everything. You just look at about diabetes, you have today, you have got several long-term infection, diabetes tests are there, and you have C-peptide, everything is there to understand the disease. Complete cancer also. So, but allegation, what is made? You know, the mortality of cancer is so difficult. Even then, our attitude has not changed. Our attitude has not changed. Whether it will be a nurse, whether it will be a doctor, whatever will be. So therefore, the you have to holistic approach should incorporate and remove the allegation made about the medical profession. That's the biggest challenge. That is possible only through yoga because yoga provides a spiritual content of living. So that's why WHO has incorporated. You took almost WHO, the global armamentarium for health policy. It took nearly 4.5 decades to define the definition of health. Earlier only physical health, mental health, etc., etc. And even though in the medical course, only 5 to 10 marks is given for psychiatrists. Okay, and so Hippocrates then only said why the physician differentiate mind and body in the form. Again, WHO defined physical, mental. They're not enough. The social preventive medicine is emerged as the biggest branch now. The people who do social prevention, they will be taken for DHO. That was their DPH and etc. So another important is spiritual health concept. This spiritual health concept, Adhyatmik Arogya, is a borrowed concept from the Eastern countries, China, India, Pakistan, etc., Japan, etc. It's a borrowed concept. The Western medicine or the Western living, which encompasses or signifies the materialistic medicine, why should accept a non-materialistic concept? Is it not? So therefore, the need for holistic approach is very essential. So that's why, and evidence-based complementary treatments with the conventional modern oncology approach. To there are many more systems are there which is being used. I will come to you on the concept there. So the evidence-based and well-established modern oncology approach, conventional that is that. What I am going to talk are unconventional, which are not being established, and but they are going to find a place in everything. So instead of advising a tranquilizer, a mood inhibitor, whatsoever, you can advise everything. Yoga nidra, which is meditation. Okay. integrative national health policy. In 2017, national health policy has been designed that you can, that comes about some 300 400 pages. If you are anywhere interested, you can please see particularly all the factions of the medical studies should show what is national integral plan. National integral plan denotes a very essential aspect how and why all the medical systems should be combined and should take place. Next slide, please. Next slide. Next slide. So now, the what is the benefit of integrative medicine or approach? One, it reduces the side effects of anything and improves quality of life, enhances recovery, stress reduction, increased immunofunction, personalized nutrition, mind and body treatment, Ayurvedic approach, lifestyle modification, naturopathy, yoga, and homeopathy. So the need for why you need for integration, these are the reasons. Benefits of integrated medicine. So the national health policy has able to identify all these benefits. That's why they are trying to adopt, and it has been made a what you call a legalized concept. And nearly about some 7 lakh wellness centers has been established across the country. I think it will go to the national health policy. Next slide, please. So now, why yoga? Because yoga is getting globalized now. Nearly about 160 countries that practice yoga. Okay? And conventional medicine requires supplementary to healthcare needs, especially multi-dimensional non-communicable NCD. So again, cancer is again a non-communicable disorder. Yoga continues to contribute significantly to human health in the 21st century to respond to the needs of the medical field. So yoga does. Yoga provides personalized consent which regulates therapeutic options and increase the body resistance, immunity power. Yoga possesses immunomodulation phenomena, hepatoprotective phenomena, and antioxidant properties, which is most essential in the management of oncological disease. Next slide, please. So, most important, the much importance is given to yoga only by the modern medicine. Dr. Karan Singh, the then health minister, in exactly 50 years back, the big, I want to read the whole thing. Yoga represents our country's unique and dynamic heritage. Seminar of Yoga, Science and Man, held 14 to 16 March 1970. The tone of the seminar was set by the inaugural speech of the then health minister, Dr. Karan Singh. He observed, I do not want yoga to be something which is kept away in one corner, locked up as a private prison of some experts. Yoga has to irrigate, as it were, the entire field of our consciousness, and it must be accepted and integrated into our religious system and our healthcare system. It has been true in the 10th International Yoga Day by the human efforts of our Gujarat International. So that conference, again I told you, is established by the nearly 100 yogis. Dhiran Brahmachari was one important person, scientists, philosophers, educators, participated in the seminar. Apart from the presentation of papers, there were several panel discussions. The 3 major subjects of discussion were yoga and education, yoga and health, and yoga and research. Next slide, please. Again, the participant, Ministry of Health and Family Planning, as I told you, All India Institute of Medical Sciences, New Delhi, say 50 years back, they are given a National Council for Physical Research and Training, New Delhi, Indian National Science Academy, New Delhi, and Indian Council of Medical Research, New Delhi, University of Delhi Commission, C. Arvind Ashrama, Center for. Next slide, please. So the participant itself suggests how significant was yoga. So then, yoga in present medical scenario, yoga and education. Now we are going to podcast in yoga and also we are going to study 5 years course in yoga and naturopathy, and yoga and education, yoga and health, and yoga and research. Next slide, please. Yoga, establishment of therapeutic yoga. Just now I mentioned, yoga was basically meant for a monodarshan, for a philosophy of mind. Why it should have therapy? And then established by the treatment, yoga treatment by Patabi Joyce, management hypertension by Shavasana, by Shavan by Dr. Date. Dr. Date, a well-known cardiologist of that time from Bombay, and Bhagat, and preliminary therapeutic kinds of yoga practices that Dr. K. Nuradi said earlier, Dr. R.H.C. and Dr. R.H. Shettiwal. And yoga and mental health by Dr. R.M. Verma. You are talking about R.M. Verma in the morning. R.M. Verma supposed to be the grandson of Raja Rao. So now, that's why he was able to implement it in and because of Verma's belief, this one we are able to get 60 bed Ayurveda hospital in many months. And psychology of yoga by Dr. H. Murthy, yoga philosophy sadhana by Dr. Swami Sitaram Sharan, therapeutic of yoga in miraculous by Swami Ananda Narayananda, and the effect of yoga therapy, diabetes mellitus by P.H. Vilpuni and Casina, science of yoga versus modern medicine, GS Way. But GS Way committee is there to establish the Ayurveda in the personal dictation. GS Way is responsible for this report. He has given a good report for Ayurveda. Next slide, please. Okay, and again, science and Kundalini by Pandit Gupta. Morning you saw some practice of Navali and exercise. Chakra, that is what you call the provocation, Kundalini Shakti Jatmana, that is one. And Kundalini is Swami Purnananda Tirtha, changing concept of human consciousness from ancient to modern times. Whether research and yoga by J.S. Chinna and Baldev Singh, running commentary in Yoga Triyas by Swami Dhirendra Brahmachari. Dhirendra Brahmachari has given a real medical background and scientific approach, and that's why he was able to convince the then Prime Minister Indira Gandhi Madam and also Karan Singh and all the medical science, all people of medical fraternity were forced to take the responsibility. That's why yoga has taken a therapeutic approach since 1970, almost 50 years now. Next slide, please. Next slide. Yes, again, details of yoga. This also opens so, very Patanjali Yoga Darshan ka anko badalikoskara literature just a passing remark. Sweta also says Shiva Samhita something RNA class which consists of literature RNA. Next slide, please. The different types of yoga, dhyana, bhakti, karma, mantra, yoga. So all these are going to have its own practicing its own influence on the oncological or whatever disease you take. They have got a medical benefit. They have got if you say Raja Yoga, some benefit, Tantrika, some Kundalini Yoga, Yoga, Yantra Yoga, they have got different what you call benefits, medical benefits are there. So therefore, I just mentioned this a possibility. Next slide, please. So yoga centers for cancer. This is where our today's talk concerned about yoga. Kaivala Dhamma, Pune, Mumbai, they have got branches, Rajkot, Chiraya Cancer Hospital, Jaipur, Wellbeing Yoga Therapy by Bloomington, USA, Bloomington, they have started. Sylvester Comprehensive Cancer Care Center, Miami, and MD Anderson Cancer Center, supposed to be the top in the world, that's from the USA. And online programs are Yoga for Cancer and Home Home Shari. So these are the, this denotes why yoga is significant for the therapeutic purpose in the management of cancer. Next slide, please. Next slide. Yes, this is, I just wanted to make it sure that how the stress is going to have a what we call molecular modifications to the neuronal constitution, why the stress is going to, how the management required it is. How the next slide please. So last. Previous one. So this signifies why yoga is required for the one India. So next comes is Ayurveda. Next. So concept of Arbuda and Chikisa. ಇವತ್ತು ಕೂಡ ಕ್ಯಾನ್ಸರ್ ಗೆ ವರ್ಲ್ಡ್ ಅರ್ಬುದ ಅಂತ ಆಯುರ್ವೇದದಲ್ಲಿ ತಗೊಂಡಿರ್ತಕ್ಕಂಥದ್ದು ಕುಮಾರ್ ಸ್ವಾಮಿ ಸರ್ Murthy sir, I will be participating in the current discussion. They are going to highlight those things. And most important, what they have said about what has been told about the anatomical and physical landmarks during the period of Shishuta, they still go in the modern applied physiology. What has been said about them, and the concept has been explained about the how the idiopathism exacts. And that's similar to that. And therapeutic protocols. What therapeutic? Why Ayurveda is required as a therapeutic protocol for the management of cancer? We have got three more important principles in Ayurveda for treatment. Yukti Apasaya, Sattva, and Yukti means designing the medicines and the therapeutic protocols in a systematic Yukti Apasaya, and then Sattva, that is related to the mind and the psychological concept, and the psychonumeral as mentioned earlier, Dailopathia, which is a spiritual. Okay, next slide, please. So, Yuktyapathia, I said about it's about a drug, Dailopatha Chikitsa. Okay? So, nature has given both melody and remedy at the same place. Nature, why Ayurveda should have so much about the cancer man or whatsoever? So, because if the nature has given both melody and remedy at the same place, just take an example, the, the area or the shabby area which gives the birth of anaphylaxis mosquito, responsible malaria, before beside that, Simcola tree is there. Even today, drug of choice for the management of malaria is chloroquine directly, that is Simcola. Okay, that's only to say that herbal medicines are required because next step please. See the Ayurveda and cancer, Ayurveda have herbal preparations and herbal mineral preparations and mineral preparations. That's only the herbs, plant medicinal plants and herbal mineral and this one and only mineral preparations are there. So this is about how the Ayurvedic medicines are designed for the management of cancer in Ayurveda. Next slide please. So here, this is a very big list. I want to submit to Murthy sir afterwards because it's very much interesting. So one thing, there is a National Cancer Institute is there. They have identified, Rajesh, they have identified 35,000 species of which have got anti-cancer. That case Rangappa from Mysore is a great plant chemistry medicine. You have know about this. He has identified nearly 1,000 molecules, 1,000 species which can have the anti-cancers. So therefore, so these are there we have Ekamalika single. It's a very big list. I just a single Ekamalika single. Next. There are nearly 15 single drugs and multiple drugs concept is there. And the classical Ayurvedic anti-cancer formulations are there. And these are the several concepts which have been established. So this is a very big list. One will take at least half an hour to explain. So just I made a passing remark. I will give it the organizers. They can keep it for a further reference is required. Okay, next slide, please. Next slide. Oh, next slide. Next. See, one back. Previous one. Arbuda Rasa. So this speaks about Arbuda is a cancer. So Arbuda Rasa has been established long back. These are the ingredients of Arbuda Rasa. So this denotes Ayurveda has already established, as mentioned, Gatre, Pachadeva, Pradesha, Putana, that's telling about how the pathogen is responsible for. So that's why you say Nidana Pativatana, that's removing the cause, and the Samprapti Vatana, that dissociating the pathogens is the basic concept explained in Ayurveda. So this signifies that Arbuda is a very old term. Even why a modern oncologist aspect should have a word like Arbuda. So the Arbuda Rasa is next slide, please. Next slide. So next slide. Shivagutika. That's again contains of Shilajita, one of the wonderful drugs which has been used in the management of where the PSA was a paper with 100 also they will be. And I don't know whether it's significant or not. When the PSA rise, we will be very much nervous and anxious. But Shivagutika has been tried and done in the various studies. Next slide, please. Next slide. Nityananda Rasa. Next slide, please. These are the next. Okay, that's all. No, back. Previously. So next. So far, I try to bring out how the drugs, herbs, how the minerals and herbal minerals are being used in the practice and how they are established. National Cancer Institute have identified these things, and also Lucknow Institute, CDS center there, they will utilize all these drugs. So there I would like to start about the drug concepts. So next I told about the other principles of, because I am talking about Siddha, other aspect also. The Sattva, that is related to the psychological concept. So that is Achar Rasayana, by following the code and conduct, and Sadhrutta, following the principles of life, Rasayana, like the you have got a immunomodulation, Again, Ayurveda is not a wonderful concept. Anybody who study about immunology, you should know immunomodulation is every week there. We have a autoimmune phenomena, immunosuppression phenomena, and acquired immunity. Ayurveda is able to identify what is an autoimmune drug and what is immunosuppressive drug and what is immunocompetent. Again, one example, if Ayurveda is there, the OHS is to be responsible for the what I call this immunity of the body. But all the drugs which are going to increase, what is going to increase the OHS, they are contraindicated in the management of rheumatoid arthritis, autoimmune disorders. This denotes our acharyas had a direct inquisitiveness or knowledge about knowing what is autoimmune, what is immunosuppression, and what is academic. So that's all about this arthrosia. And that's for the modern concept, how you want to understand about this arthrosia, brain and body is being linked. Okay? And immunological dysfunction and aberrant stress. Aberrant enough amount of stress is going to cause immunological dysfunction. That immunological dysfunction is again nothing but the establishing the concept or hypothesis of oncological disorders, whatever it may be, leukemia, it may be tumor or whatever. Okay? And then physiological component, immunological component, CNS and immune system, autonomic nervous system, but hypothalamic pituitary gland, cortisol hormone. You will listen to the management during this. Cortisol hormone, there's the happy messengers, serotonin, acetylcholine, dopamine, cortisol, which are being improved by power education, by yoga, or some of the where they are what you call Medo or science are there, like Rami, all of you know, very common. So let's check this. So then you are past there. Not go too much the details. The spiritual health, as I said earlier, knowing oneself, spiritual health, meditation, vipassana, siddha samadhi, vipassana is again about that. So the Daiva Pastrya is Mani Mantra Prabhava Idina. So which has behind the perceive of the what is physical, mental, and also the social concept, they come under the Daiva Pastrya. That is Ayurveda is called as Bija Avaya Dosha. That is called as the when you speak about the genetic predisposition. When telling about the Prakriti, the set Sukashone Samega Yavut Kato Devu that speaks about how the genetic predisposition is. So again, the cancer is nothing but the idea of understanding the mutation. We are not able to understand the proliferation of cell phenomena. Since the Gregor Mendel identified the mutation concept, thus mutation concept is well established in the modern oncology. So our acharyas had a real understanding about the Bija, that is a concept of genetic predisposition. Next slide, please. So the Panchakarma concept is there. I will not go to details. That is why the body is equal. Next slide, please. See, most important, what exactly is today Panchakarma is becoming buzzword. Everybody who comes to treatment want to know about why the Panchakarma. What exactly Panchakarma do? Panchakarma is not going to cure any disease which has been identified with the modern medicine Ayurveda, not going to cure. They are going to reduce the intensity, recurrence rate, and also they are going to facilitate the drug therapy. There is a modern Ayurveda that is imitated. So therefore, their Panchakarma treatments are very significant from the point of the immunomodulation, adaptation, and utility of the medicines. Next slide, please. So these are the several. Go back up, please. Previous one, sorry. Previous one. So these are the different Ayurveda aspects in the country which actually treat cancer. Suddhi Hospital at Lucknow, Karma Ayurveda, Indore, Jaipur, they have 3 branches. Udarjana Ayurveda Hospital, Chennai, KIMS, Premier Hospital. Specialized treatments, Panchakarma, herbal medicine, diabetes, yoga. So these are the treatment protocols. So this is about how and why Ayurveda is required for the management of cancer. So these are all already existing more than 5 decades. This speaks about how and why Ayurveda is required for the management of oncological disorders. Next slide, please. Next slide. Therapeutic protocols I told just now. Prevention of positive factors that talked about the much by the previous speakers, and bypass elimination, that is anti-oxidant phenomena, lifestyle adaptation and modification. That is talked much about this regeneration and phenomena, restoration of psychosomatic regulation. So Ayurveda has always said the mind and body together. Any other something can recollect. While explaining the physiology sleep, they say how they sleep. That speaks about then also Chittam Prasad, the Lakam, that's all speaks about the how the mind and body is related. A psychosomatic concept, wellness is established. So psychosomatic understanding is most essential in the management of the what you call oncological disorders. We pay attention. Who has the fear of recurrence, fear of death? Is it not? Fear of death, fear of recurrence is there. Fear of failure, fear of improper diagnosis. Many things are so therefore that psychosomatic relation can be better managed with this bifurcation. Elimination means the Panchakarma concept what you told about. Next slide, please. So naturopathy and so naturopathy is again a drugless therapy, healthy rental, etc. Why it is significant? Because we have eliminating process, polar irrigation, diet and meditation. This will take much time. I will listen to Dr. Vijayalakshmi Deshmane, how she came across and how got rid of some important problem through prayer and meditation. Well, there is no better person than to explain other than Vijayalakshmi Madam, supposed to be a renowned person in the field of oncosurgery, not a physician. So that's all. So these are the naturopathic principles which has been adopted in practice to be. Next slide, please. So here, naturopathy, how they approach detoxification, enzyme therapy, vitamin and mineral supplement like hair modification. So these are the primary goal of naturopathy. So I said about yoga and Ayurveda and then natural. Next slide, please. So these are the previous and previous. And okay, next. So this is all about the naturopathy. That's enough. Almost all hospitals they try to cope up with the naturopathy, drugless therapy, RNS therapy, and enema, and it doesn't require any much better care because already any hospital can adopt, even the modern hospital can adopt. Okay? So now homeopathy cancer treatment centers, Sri Krishna. So homeopathy is again a system brought to India by Dr. Hahnemann. So that's why now it is also getting its importance in the management of the cancer disease. So among all the alternative systems or all the complementary systems, Ayurveda, Yoga, etc., homeopathy has received applause and though it do not have a scientific establishment like Ayurveda, Yoga, etc., but they are able to manage some of the disorders related to the oncology in a better way. So that's why major hospitals are there. Sri Krishna Clinic and Cancer Research Center, Ernakulam, Kerala, Sri Niswamiti Clinic, Lucknow, Homeo Foundation, Dr. Bhatteshwar Prasad, Dr. Ankur Prakash Clinic. Why it is significant? Because personal treatment plans are there, holistic approach, non-invasive, affordable solutions are there. And then symptoms of management. The three are very common: arsenic album, cadmium sulfur, and Vruta granules. So these are homeopathy concepts and hospitals which exist for the management of cancer. Next slide, please. Siddha. Again, in Tamil Nadu, South India, Siddha medical system is got more importance than any conventional alternative or complementary system. Siddha and Boga Siddha, Varma hospital. Varma means Varma they use. Varma is the vital concept. And the cancer has got a vital consideration, the vital organs, etc. Boga hospital, Tiruvannamale, Tamil Nadu. JCB, Balaramaya Siddha Cancer Hospital, Tiruvannamale. So Tiruvannamale is known part of India for its spiritualism. People across the globe, they come to Tiruvannamale to have a retreat in the spiritual medicine. Probably that particular. And Viratika Siddha and Varma Hospital. Varma means again they use Varma, they use work. And Jyoti Siddha and Yoga Hospital, Tamra, Chennai. And then Siddharya, Armakam, Chennai. So these are the Siddha medicine for cancer. Next slide, please. So Unani Hospital. Now, Ayurveda, modern medicine, already you listen to the speakers from the morning, and then we have yoga, and as I have stressed upon more because my topic was special reference to yoga was given, that's why I put much explanation for the yoga approach. And then we have Ayurveda concept, and also naturopathy, and we have Siddha and homeopathy. Now Unani. So Unani hospitals for cancer treatment. Greek Cancer Care Hospital Center, Pune, Al-Hakim Unani Medical Center, Delhi, Masjid Unani Hospital, Delhi, Unani Care Hospital and Research Center, Delhi, Deveda Unani Clinic, Hyderabad, Isla Dwakanika, Mumbai, and Adib's Unani Clinic, Kozhikode, and Europe. So these are the different Unani hospitals which are taking care of the cancer. Next slide, please. So, friends, I try to explore the different medical systems, and also I try to establish. And I hope if I am not established, if I am not convinced, if I am able to confuse also, that is a great effort I believe, most important. So the different medical systems have got a different role. I try to take home message for the youngsters, students, for you. The present medical scenario is very complex, starting from catering to learning and practicing and imposing and understanding and in the article. In that scenario, the complementary medicine is essential, because still the complementary medicine like yoga is a totally spiritual medicine, Ayurveda is not totally spiritual medicine, and homeopathy is not a spiritual medicine, and Siddha is not totally spiritual medicine, and but yoga is totally spiritual medicine. So the spiritual aspects are going to imbibe the what lacuna, that is everything is available, but in abundance, but we have lacuna, so that is attitude of the medical professional. So therefore, in considering all the philosophical, physiological, and pathological and therapeutic approaches, yoga has to be stressed upon. Yoga should be practiced. Yoga can be used in all. Why integration? Yoga can be used in the modern medicine, oncology. Yoga can be used in Ayurveda. Yoga can be used in the homeopathy. Yoga can be practiced in the. So therefore, I stress upon again. And what I think I done justice to what Shada is particular about yoga specification. So I did it. Thank you. Thank you very much.
Thank you, sir, for your valuable insights. Now I request the co-chairperson, Dr. Rajesh sir, to share his thoughts.
Good evening to one and all. It's a privilege to always hear the Guru Basubhadra sir, that he comes with the combined form of the medical messages, that why we need to be all work together, because anywhere, anyway, or any place, or when the illness comes, we need not to think about the one way, because sometimes it may good for work in one way, but most of the time what we are being looking in this society is it should be a multiple direction should be there. And always, unless until we approach the multidisciplinary way of thinking, the prospective way of treating the illness, it is the best way to treat the medication. So that's the reason where the different approaches should be there, whether it should be an allopathy or the Unani or the Ayurveda should combine together to give the prosperity for the patient. That is the only way where the healthy society can be made, and we can hear the wellness should be there. So in that aspect, we are really honored to hear and congratulate Guru Basubhadra that he has given an ample view of that how integrated medical future is there in our system. And being in the India, the yoga is going to be an futuristic prospectiveness, that customized yoga and the other disciplines should be brought to the curriculum in the lower classes itself, that how a healthy society can be built right from the childhood. So yoga should not be restricted only for looking at some asanas. that to make the body bend. So, but it should be the given the task of that how the healthy mind and how the healthy the body has to be made, so that we can prepare for the next generation that free from the disorders in a preliminary way. In that the perspective, the sir has given the limelight of that how the integrated approaches can be made. Thank you very much, sir.
Thank you, sir. Now I would like to invite Chairperson Dr. VandeWellness sir to share his thoughts.
Hello everybody. Dr. Basavaraj ಅವರ talk ಮೇಲೆ I cannot comment anything because I attended one of his talk recently on Manasa Yoga. Yeah. He was telling me that to prepare the presentation with the experience of 35 years of teaching, if I am right, sir. He was telling me that day that to prepare one presentation at this age with that kind of experience, he took 15 days of time. Ah. that shows his commitment. See, the thing is, anybody can come here and talk on the basic terminology, basic concepts. Everybody will do that. Architecture will do that. But expert talk is this. The expertise, any kind of expertise you have, the amount of effort you put to prepare the presentation on a particular topic is so important. That's what I saw the same thing, same sort of effort in this talk also. Thank you very much, sir, for that your excellent talk. But I would like to, I have made one observation here. Because he was talking about the therapeutic benefits of yoga therapy, and also in the spiritual health. Sorry that. I was going through one of the talk by an expert, VandeWellness. Right? You might have heard about it. He's no more. Recently passed away. He was telling that in America, one got cancer, right? And that particular person contacted him, and in turn he said that please chant Vishnu Sahasranama. And after chanting the Vishnu Sahasranama, that particular person was tested for not having the cancer. So that is what one of the example in this case actually. I was going through, because knowledge is knowledge, I cannot, because I am coming from the allopathy, I cannot ignore this kind of technique, right? So I was going through, why he has told, go through the Vishnu Sahasranama, it addresses you. So I am going through that, one of the grantha, there is a Bruhati Sahasranama. There is a grantha called Bruhati Sahasranama. It is a collection of 1,000 hymns from the Rigveda. It says, those hymns says that the meaning for each and every terminology that is there in the Vishnu Sahasranama. And in that Bruhati Sahasranama, this has been quoted. Prana, excuse me, 1 minute. Yeah. It says that pranayamehi dahe doshan mano vag deha sambhavan ಅಂತ ಬೃಹತಿ ಸಹಸ್ರನಾಮದಲ್ಲಿ ಹೇಳ್ತಾ ಇದೆ. ಏನು ಅಂತಂದ್ರೆ ಪ್ರಾಣಾಯಾಮದಿಂದ ಯಾವ್ಯಾವ ದೋಷಗಳನ್ನ ನಾವು ದಹನ ಮಾಡಬಹುದು ಅಂತಂದ್ರೆ ಕಾಯ ವಾಚ ಮನಸ, ಕಾಯ ವಾಚ ಮನಸ್ಸಿನಿಂದ ವಿಷ್ಣು ಸಹಸ್ರನಾಮ ಪಠಿಸ್ತಾ ಇದ್ರೆ ಅಂಥ ದೋಷಗಳನ್ನ ನಿರ್ನಾಮ ಮಾಡಬಹುದು ಅಂದ್ಬಿಟ್ಟು ಬೃಹತಿ ಸಹಸ್ರದಲ್ಲಿ ಹೇಳಿರತಕ್ಕಂತಹದ್ದು. ಆ ಬೃಹತಿ ಸಹಸ್ರ is an explanation of each and every term of Vishnu Sahasranama. Right? So that's why, and another quotation is also there. Any mantra you chant in order to come out with these kind of disorders, right? We need to go for mantras. In the last Manasavali itself, I was telling you that there are 7 crores of Maha mantras available. And it says that any mantra you chant, to come out of that process of chanting mantra, at the end, you need to chant Dhanvantri mantra. There is a rule. At the end, you need to chant Dhanvantri mantra and come out of the process of chanting. Right? Ashtamahamantra is there. Ashtamahamantra is there. I don't want to tell the same thing. So that's why Dhanvantaraye Namaha has to be chanted at any time, at any treatment in the Ayurveda. Please tell that the doctors, for the patients, they need to chant Vishnu Sahasranama. After chanting the Vishnu Sahasranama, Dhanvantri mantra is a must thing to chanting. Then only it will have some sort of effect. Right? So, with this, I thank Professor Basavaraj for his excellent speech. There are a lot of things to talk. Probably, if I'm going to get another chance, I definitely have. I need to talk on the research of integrated research, right? With this, I would like to thank the Professor Basavaraj for his excellent speech, and also I thank the organizers for providing me this opportunity to talk on this, to give my opinion on this. Thank you very much, Ananda.
Thank you, sir. Now I request Dr. Anjaneya Murthy sir, Dr. Aruna ma'am, and Dr. Kumaraswamy sir to felicitate the speaker, Dr. Guru Basavaraj. I also request you to felicitate the chairperson, Dr. Maniraj sir. Thank you, sir.
Final session, the panel discussion, please. patient, they are not come up with a single microbial infection or single entity. It's a complex disease, right? So more than a disease, their quality of life will be decreased, their physical and psychological aspects will be disturbed. Okay. So with respect to that point, what are the way we can increase their physical, psychological, or social? What? Yeah, this is what. And I'm limiting these presentations only to few aspects because we can't cover all the aspects in a 5 to 10 minutes. Our main focus is research aspects, which is already done, ongoing, covering the management or interventions of yoga in cancer care with respect to symptoms management, that is improving quality of life, then targeting fatigue, pain, sleep disturbance, psychological supports, quality life and functional outcomes, psychological and mechanism benefits, and what are the aspects we can cover or intervene yoga during chemotherapy or post chemotherapy. So coming forward, symptoms management, primarily targeting core issues, cancer-related fatigue. That's the main thing. If you see post chemotherapy patient or the patient undergoing chemotherapy, it's a completely different story. Like we all know, I used to work in Bharat Cancer Hospital under I got a opportunity to work under Dr. Vishweshwarya sir, oncologist, medical oncologist under Bharat Cancer Hospital. And we will to come across day to day chemotherapy patients, and the main thing is the fatigue and other related symptoms they face. And covering the research aspects, the landmark yoga for cancer survivors, the randomized controlled trial including more than 400 patients states there's a reduction in 20 to 37%. There's a reduction in 22 to 37% in cancer related fatigue with respect to interventions of yoga during chemo or post chemo or before chemo. That's also a good number. See, 22, 37 may seem to be small number, but to the patient suffering from 100% of illness, even if you get 22% or 37% of it, that would be great. That too, non-drug therapy. We are not using any drug here, we are not giving any molecule here. We are just coping up with the conventional or the main treatment. Coming for sleep quality, it also shows the sleep quality mean PSQ score improvement to 2.2. Coming for joint and pain symptoms, significantly reduced. So you can see in these slides, psychological and emotional health with respect to interventions of yoga, we can see there's a 37% reduction in anxiety. Main core is like I do come across cancer patients even yesterday. In my OPD, in my Vijayanagar OPD, I do got one spindle carcinoma. I just want to share a few things. High-grade spindle carcinoma. The lady was so concerned, 52 years old, 62 years old. She finished her post surgery, completed radiation, and doctors have advised chemotherapy, and she don't want to take chemotherapy. She asked us, "Sir, can I skip chemotherapy?" I have completed at that point of time. The doctor advised me for surgical and also post to take some 15 settings of radiations, and right now I'm completing. But doctor has said to start with 3 to 4 chemotherapy for a double check, or for a 100% sure or 200% sure. And first thing I said, she asked me the opinion. First thing I said, I'm proud to say, I'm not a chemo doctor. I am not able to give any advice on chemotherapy. Whether you have to take chemotherapy or you should not take chemotherapy is up to oncologist. Being from other conventional system of medicines, if you advise or even if you advise or I advise them not to take, that will be just what malpractices. What I said, please, if you got any doubt, go for second opinion only with oncologist. Second part, if you come for Ayurveda, expecting the Ayurveda result, I can give 100% of Ayurveda principal treatment, improving quality of life. Okay, that's the main focus. We all having conventional system of medicines, we should practice. We should not do malpractice. If you don't know the science, definitely we should not get. We can take second opinion and we can assure that what we can do. When Ayurveda yoga, what we can do, we can climb that. And advising not to take or to take is not our part. And coming to this, I quoted that example because of anxiety. She was suffering from anxiety, as she has seen some chemotherapy patient. She don't wanted to go to chemo only because of those conditions. So we found that with yoga interventions, 37 to 40%. There is a reduction in anxiety, depression improvement, 42%. This is not my numbers. These are present articles number, peer-reviewed articles published in PubMed and related high standard journals. These are not my numbers or my clinic numbers. These are PubMed and high standard journals. And also we can see stress biomarker reduction from up to 28%. And also stress and fear of reoccurrence is also one of the main things where we just hesitate to take treatment or what look for other therapies. And yoga, being a global therapy as well as non therapy, is definitely supporting the patient by improving the global quality of life, physical functioning, and enhancing the cognitive functions. And what are the cognitive functions? Like improving physical role, enhance emotional well-being, increase social functioning by, if you go to number 23, 31, 18, 27. If you leave number, it also got significant role, and raising a hope for a cancer patient. Coming for psychological mechanical benefits, and is it okay only if you say numbers and it does yoga will relax things, yoga relax mind is also helps for emotional balance or other things. We don't need data, right? Here is data. How yoga can help in reducing inflammation. The anti-inflammatory effects of yoga are seen by reduction in pro-inflammatory cytokines like IL-6, TNF alpha, and IL-1 beta. And also autonomic regulations by heart rate variability improvements and normalized cortical slope patterns indicates enhanced parasympathetic and sympathetic functions and improve stress response. And also there are mechanistic pathway. I don't want to go take you there. And this is a graph. Coming for support treatment, support during treatment or prior treatment or post treatment, how yoga can do. Either we can talk 1-to-1 person during active treatment, adopting yoga protocol, demonstrate anxiety reduction, enhance cognitive functions, and helping them for better response to chemotherapy or any other conventional system of medicines. And long-term survivorship. Yoga always gives us what inspirations, always gives inspiration to a socialistic and emotionalistic aspect and post-recovery treatment. The strong evidence-based exists for post-treatment interventions with robust data supporting benefits of fatigue reduction, sleep improvement, quality of life enhancement. These are the whether yoga is safe or not, definitely is safe, but based on your condition, based on your oncological aspect, we should consult an oncologist as well as yoga therapist. Going randomly for random yoga, saying yoga is good, that definitely bad. Coming for key takeaways from this small clinical presentations, what we said, even if you need technical data or statistical data, we can see fatigue reduction from 0.4 to 0.58, sleep quality by 2 to 3, anxiety, depression. The data is in the screen. I don't want to read that. Coming for the main focus is that all the meta-analysis of peer-reviewed journal, we got to know that this significant role. I don't want to take the number, but this is definitely a significant role, significant improvement in lifestyle, quality of life by intervening yoga to oncological patients, any sort of patients. So with this, I thank GRC for giving me opportunity to present these articles, some review articles, and these are the references. And with this, a scientifically supported case strategy, robust evidence based, and safe integration, and also enhanced survivorship. We all, whether we are patient, non-patient, whether we medical or non-medical, and we take a pledge to practice yoga every day and keep ourselves healthy. Thank you. You can ask.
Thank you, sir, for giving us the real statistical insights in the research field of cancer and yoga. And due to time constraint, I request Kumar Swami sir to facilitate Dr. Sridhar sir as he has to leave to another meeting. Post, we are going to continue the Sambhagana. Now we'll be continuing.
I request Dr. Veena ma'am to talk on glimpse of success story in Ayurveda and management of cancer. Please, ma'am.
Very good evening to one and all. Om Shri Dhanvantare Namaha. Most respected dignitaries on the dais and off the dais, my dear students. And this is a proud moment for me because I am sharing the same stage with my most respected madam, Arana madam, my beloved teacher, and many other teachers over here, Anjali sir. And if you tell me to be in the ward, I can be there in the ward for day and night. But to speak, it's a little difficult. Still, for me, I should introduce myself because I'm a professor in the Department of Chikinsa. Those are not knowing. And then we have established the cancer clinic, Ayurveda Cancer Clinic in JSS Medical College since 2018. Since then, we are taking cases. Most of the time, it's like a stage 4 cancers because that's the time even modern people will not, or the allopathic side, they don't have much things to do except the like the palliative care, like the symptomatic treatment. So with that, I have started with my PG in JMC Mysuru. So actually now patients are coming with word of mouth. Each month I can tell like more than 20 to 30 patients per month we have now. And we can even give them like, we are giving them with a good quality of life. So few one or two cases I wanted to discuss here because we don't have much time here. Just to tell that even we can do, Ayurveda can do something most better in such patients to improve their quality of life. So, pranamas to Super Guru Parampara. Thank you for the team Casino Yoga for giving me this opportunity, especially Dr. Shanai sir. So, thank you, sir. So, case 1 as a chief complaint is a 56-year-old male patient came with a complaint of a severe low back pain, unable to move or walk with support. It is a known case of plasmablastic lymphoma under chemotherapy, and the impression of the X-ray was lumbar spine fracture. Actually, he was treating in Bath Cancer Hospital. I was under chemotherapy. After the 10 days of chemotherapy, he just had a sudden fall. It was not a fall. Suddenly, he sat on the this one, and then by the time he got fracture, but exactly that time he was not knowing that there is a fracture. But the thing was, he was unable to move or even to just turn from the bed also. So they have shown after the X-ray they have taken, they have understood that there is a fracture from D12 to L5 vertebra. So they planned for surgery, but according to the consulting oncologist, they told because it's not the time to take risk for the surgery, so they were like taking rest, and with the ambulance they came to our hospital. So this was the condition. One last time. Yeah. Yeah, this was the patient's condition when he came. He was totally bedridden. Okay. Later on, for about 10 to 15 days, he was admitted in our hospital. So with the just with the Ayurvedic management, few of the therapies, external therapies also, we were able to manage this condition. So this was the condition with the patient. Initially, he was very much difficult. He was screaming actually each moment. And so these are the treatment given like Ekanga Barbalepa, Katipichu, Urvena with Karpura Thaila, and Matrabasi was given to him. And along with that, some other internal medications also. And this was the patient. Once he came just last 4 days back to our hospital, so he wanted to show me even he don't want to take a support. He wanted to show me that I could able to get up without any support. And this is how he's getting this one. And this is what our OPD. So this is why means it may not be directly a cancer therapy, but how can we manage the the other associated complications in a right time if they are coming to us. So this is what. And this is another case of a 67-year-old male patient came with the complaints of severe pricking type of pain and burning sensation in the right side of the chest region associated with hardness around the right nipple region, and complaints of severe heartburn and regions also since 2 months, and had complaints of difficulty in swallowing, reduced appetite, and disturbed sleep for 2 months. And it was a diagnosed case of squamous cell carcinoma of esophagus. And this patient, because they have some 3 to 4 patients around them, the same esophageal cancer, and they have seen that after surgery and radiation therapy, how the complications has occurred, and they were not able to take it, that died within after few months of the therapy. And he don't want to take any of the modern allopathic treatment like chemo or radiation. Even I have tried to convince him, like, no, it's a esophageal cancer. It may be in the early stages, you can just go through the surgical intervention and later on chemotherapy, radiation therapy. He told, and such a thing is but then once the consent has approved from their family members, no, have taken up this case. And initially we have given only the little bit Vidurejana. So most of the time we give a poster show that initially, and then we start with the treatment. And by 2 to 3 days itself, because it was a severe burning sensation, the whole of the right side of the chest. So he was unable to speak or even sleep and all. So, but we started with the medications, and with the Gestimadu Kshirapaka 50 ml twice daily. So immediately after giving this, by the third day itself, he could able to reduce his symptoms by 50 to 60%. And by the time when he just went out of the, after 8 to 10 days of the treatment, almost 60 to 70% reduction in the signs and symptoms, especially the burning sensation. And actually, he's speaking something. I don't know whether it's audible. Okay. Let it be. But he was explaining how about, so what is the important the benefits he got. And later he just 3 days back he came to OPD. That time he was expressing, because I was thinking like maybe initially in this case, because it is a fresh case, and initially we may get a very good result, and later on we don't know. But after 1 month he came to our hospital for the follow-up, and he was telling 90% reduction in the symptoms. So this is what we will get a new this thing, that even in the initial stages also we can give some of the treatment if we go through the proper treatment principles. So this is another case of 41-year-old male patient came with the complaints of generalized weakness, bilateral pedal edema for 2 years. They also had complaints of exertional dyspnea and palpitation since means often on for 2 to 3 years. Patient had complaints of loss of appetite 6 months, and this was a case of myelodysplastic syndrome. And these people, like, no, he's from actually Udupi district, and already consulted since 2018 Manipal hospitals, and later on in Victoria, and they have referred to Kidwai. Lastly, they told only the transplantation, the bone marrow transplantation, but they don't want to go for that because they have told like 70-30 or 30-70 chances, because they don't want to take a risk. So they came here. He is a little bit far relative of mine only, and he came here only came to know that. And this patient, the specific thing was, he was having a severe pain. Once he get up in the morning, severe pain in the right hypochondrium, like the liver areas, especially he's telling. And while going for the motion, he's telling, ಯಾಕೆ ಬೆಳೆದಾಗುತ್ತೆ ಅಂತ ಅನ್ಸುತ್ತೆ ನನಗೆ, ಯಾಕಂದ್ರೆ ಮೋಷನ್ ಹೋಗ್ಬೇಕು ಅಂದ್ರೆ ಅಷ್ಟು ಪೇನ್ ಬರುತ್ತೆ ನನಗೆ. And one more thing, a pedal edema. Almost 2 to 3 years he was with the pedal edema. And every time his HB will be up to 2.534. At the time he came to our hospital, it was around 3 to 3.5. And every 15 to 20 days there will be a blood transfusion. For that he will travel to Tumkur, because in somewhere around like in Udupi district or even Mangalore, nobody wanted to make him get admitted and give the transfusion. Only in Tumkuru they know about him, and they are like, okay, whatever may be the risk, they are ready to take it, and hence he will travel from Baindur, that is Udupi district, and to Tumkur every 50 to 20 days for the blood transfusion. So, but once he came here, we could able to manage him with the classical Snehapana actually. So Snehapana followed by the Virechana. So with the Snehapana, during the Snehapana itself, we could able to see the pedal edema was completely reduced. That's what he was telling. Since 3 to 4 years, he never seen his legs in a normal manner. And then whatever the palpitation he was having, the shortness or the breathlessness he was having, almost everything was reduced, and his appetite was improved. We could give him a proper Virechana, and then later on, we have given him the protocols, whatever accordingly, the different medications. And now it is almost, I think it is the third or fourth month, just last 15 days back also he came and he has taken the treatment. Now the transfusion duration has reduced. Now it is almost 1 month, 3 days, 4 days only after that he is now receiving the this one. So still they are having the hope that okay, in further it will again the duration may increase and he will become alright. Now he also joined to, means he was not having a job because of this almost 3 years. Now he is joined to a particular job. He is also doing that. So that is what the improvement in the patient we have seen. So with this, what I would like to conclude is, so Ayurveda can do a lot of things if we go through with each cancer patient is different. Maybe a stage 4 cancer, still we need to understand which system is involved, what are the dosha dhatu involvement, and we have treatment principles we have to go through. So whether we can give only a Pradhu Virechana or a classical Virechana or only some Kashta Aushadhis or any other like the herbo mineral combinations we have to use, and that should be like every 15 to 20 days we need to monitor them accordingly. We can treat, but actually to tell the most of the time what according to the treating oncologist, they will tell only 2 to 3 months or 6 months they will be there. But we have patients with us like more than 2 years, 3 years with this type of quality enhancing medications. So these are the few things. So this was the conclave, cancer conclave we did some 2 years back, and we are now anticipating this a conference in the first week of January 2026. So Dr. Balendu Prakash was there for the conclave here, and we are also doing some of the research works. This is a research work in minimizing the side effects of chemotherapy. So even Drakshasa was using here. We have Rajitsa PG and PG department is working on this particular oncology, and we have other works now. Right now it is going on. One is once again Dr. Mahant is here and he is working on improving the quality of life in undergoing chemotherapy stage 4 cancers with the Dr. Kiran Sir, JSS Medical College, and Dr. Spurti on Ayurvedic Comprehensive Management stage 4 cancer vis-a-vis Arbuda, only in the stage 4 cancers, especially her drug is having Nityananda and other things. And another one is Pani Akshara. This year we are going to try with this Pani Akshara as a Shamanoshti in the management of gastrointestinal cancer. So these are the few cancer patients each every year we celebrate, observe the cancer day, and we felicitate a few of the cancer patients, and we take feedback from them, and even because it will be encouragement for our PG scholars to come forward and take oncology as their subject. And these are the case records we do every day. So coming to the conclusion, Ayurveda can help with the cancer prevention, especially rasayana therapy, like a Vyadhi Utpadaka Pratibandhaka, like a primary prevention, and Apunarbhava Chikitsa, like a secondary prevention, and Ayurvedic Rasayana, Panchakarma Yoga, and other interventions helpful for cancer regression, reduce side effects of cancer therapies, enhance the efficacy of chemo and radiation therapies, balancing the immunity, improve overall quality of life, and even the Sattva-Vijaya Chikitsa, especially the Sattva-Vijaya Chikitsa and the Deva-Vibhav Chikitsa, is having a major role in the management of cancer at any stage, especially in advanced condition. And here what I would like to tell is, most of the time, only with the name cancer only patients are like under depression or maybe so many other tensions, and even the chemo side effects, especially the ladies who are coming to us, their first aim is ನನಗೆ first ಕೂದಲು ಬರಬೇಕು. They are not about their worried about their life. ಕೂದಲು ಬರಬೇಕು. My students are here. They know how they are expressing their feeling in the wards. So even with that also is actually with our treatments and few oils when we mention, actually they are getting very good results for that also actually, and when we spend little time with them, so that is what I really encouraging them, and I think more than the medicines, how we show the empathy towards them, that's the most important factor. So Sattva-Vijaya Chikitsa and Deva-Vibhav Chikitsa or other counseling, spending time with them is more important, and the family members, how they are looking after them. And so I would like to give the acknowledgement, especially Dr. Aruna Madam, my guide in PG, and PhD guide Dr. Gajana Hegde sir, and Dr. Anil Thomas for the PG and PhD co-guide, whom under I have trained for 3 years while doing my PG, and almost all the cases he is referring to me whenever it's a stage 4 cases, and really thank him and all my patients, and especially the JSS management, because they are actually supporting me a lot to continue with this cancer clinic. So thank you, and thank you for the opportunity to speak and taking from all of you. Thank you, sir.
Thank you so much, ma'am, for giving us clear-cut ideas and also giving us the hope that allopathy and yoga.
Okay, good. So what is cancer? Okay, good. So what is cancer? What is cancer? ಹಿಂದಿ ಹೇಳಬೇಕು. ಒಂದು ಸೆಲ್ ಇರುತ್ತೆ, ಮಲ್ಟಿಪ್ಲೈ ಆಗ್ತಾ ಹೋಗುತ್ತೆ. ಸಿ ಎ ವೆರಿ ಸಿಂಪಲ್ ಡೆಫಿನಿಷನ್ ಇನ್